www.healthcmi.com. Acupuncture continuing education online today. Acupuncture found effective for rheumatoid arthritis relief. This article was published at healthcmi.com on December 28th, 2018. Let's take a look. Researchers conclude that acupuncture increases the total effective rate of drug therapy for the treatment of rheumatoid arthritis. Researchers from the second affiliated hospital of Anhui University of Traditional Chinese Medicine combined acupuncture with standard drug therapy. Patients receiving both drug therapy and acupuncture in a combined treatment protocol had superior outcomes compared with patients receiving only drug therapy. The researchers conclude that the addition of acupuncture to standard drug therapy is effective for the alleviation of relevant symptoms and the regulation of rheumatoid arthritis-related laboratory indices, including rheumatoid arthritis factor, RF, rheumatoid factor, erythrocyte sedimentation rate, platelets, fibrinogen, D-dimer, the many blood factors. So this study, which was approved and funded by the National Science Foundation of China, has both the subjective improvements, in other words, patients note they have less pain or swelling, along with the objective improvements that are measured in the blood work. They also found that C-reactive protein improved those levels, which is a protein produced in the liver in response to inflammation. And so they used a high-sensitivity CRP test to determine that. Pretty good work. I like this. There are no easy answers in the case of rheumatoid arthritis. I think it's just one of those battles where we really roll up our sleeves and get in there and help the patient to make life happy. In other words, to keep them ambulant so they can move, to make every day when they get up a good day. Because rheumatoid arthritis can have a little bit of a runaway train effect. When it gets very severe, people can be somewhat immobilized, unable, let's say, to use their hands, with a lot of suffering and pain. And they give the acupuncture points in this study, some pretty basic stuff here, which makes sense to me. They mentioned certain points used in the study that was bladder 18 Gan Shu, bladder 20 Pi Shu, bladder 23 Shen Shu, and so on. Pretty standard points. Nothing out of the norm here. So I think in many ways this study reflects what you might find in an acupuncturist clinic on any given day. Granted that the points, because it is a protocolized study, are standardized to a simple set of points plus some sure points, that's local points of tenderness and pain. So that doesn't really reflect a true clinical scenario where someone's diagnosed and individually prescribed acupuncture points. This prescription that everyone had to use in the study is generic enough where it reflects an overall pattern of what acupuncturists might use. What's nice in this study is that there's definitely significant improvements. In other words, the patients in the study, in two study groups, all had standard drug therapy. And drug therapy can be a little bit harsh for rheumatoid arthritis at times. It's very strong, definitely has side effects. I don't put a judgment on it, whether it's good or bad. It can provide relief. It can be destructive to the liver and kidneys, for example. It's pluses and minuses, trying to keep it under control. However, when you take the acupuncture and add it into that drug therapy protocol, into that regimen of care, the effective rate goes up. Now that's where I get very interested, where patients have less pain, they have better mobility, the blood work is better, lives are better. And so this is an integrative medicine approach where patients are getting pretty much standard drug therapy, but now you've added the Chinese medicine in, and what you see is better results, which is why I like this study. And this is not exactly an original study in the sense that this work has been done before by other researchers for rheumatoid arthritis, as well as other types of pain disorders. But what we're finding is a significant level of patient outcomes where I would even go so far as to suggest that if a patient has rheumatoid arthritis, and is not getting regular acupuncture, they're truly not doing all they can do to make life better, because the level of relief is very significant. That doesn't overcome issues of access to care, issues of affording care, just getting to a place where people can get care. There's always been ambulatory services, but now that we have things like ride sharing services and things like this, people are having an easier time to actually get to an acupuncturist office, which is also good. So now that the access to care is improving and there are more and more acupuncturists available, this is now becoming a reasonable treatment option for people globally. So keep in mind that even in the United States, as of this podcast, not every state even has acupuncture laws. It's almost every state. There's just a few outliers. There are some countries where there's only a handful of acupuncturists in the entire nation. And yet in California, for example, there's over 10,000 acupuncturists. So access varies quite a bit. Given the results I've seen in my own clinic as an acupuncturist, given the results I see in research, including this one, if you go to healthcmi.com and click on news, you can take a look at this one entitled Acupuncture Found Effective for Rheumatoid Arthritis Relief. I would suggest, if you have friends or family or loved ones that have rheumatoid arthritis, to help them get there and get some relief. And what's interesting is that this isn't a condition that necessarily responds to very aggressive acupuncture, let's say kind of a sports medicine approach to a shoulder sprain or carpal tunnel syndrome, let's say, where you get in there, nice strong treatments, and then it's gone. This one sometimes takes very gentle treatment, sometimes lighter gauge needles, lighter depth of insertion to slowly guide the patient back. And in Chinese medicine, we say that's because with rheumatoid arthritis, it can affect the overall, we say, qi and blood level. Think of it as your overall energy level gets depleted due to chronic illness. So a lighter, more gentle therapy can be quite pleasant. It's very rewarding when I put a few very gentle needles in a rheumatoid arthritis patient, and just to see the smile on their face and the bliss that they feel during acupuncture, which is quite common. I guess the feeling is now they have a little bit of relief. It's a kind of a beautiful moment. And then they come back and you see literally much less swelling, let's say, in the elbow or in the knees or in the hands. And you see them getting up on the treatment table more easily, just kind of pop right up there instead of kind of crawl their way over to the table and try to get onto it. It can be a very dramatic change, and it can be done, again, with these very gentle treatments that can move the patient slowly forward. It's not an overnight miracle type of thing, and there can be subacute flare-ups that come on with like a storm, and then we have to get them under control again. So it is a beautiful thing to be a part of that for the patients, to help them really enjoy their lives. Many can, over time, reduce the amount of medications they take because of the acupuncture, which has some other natural benefits with less adverse effects associated with medications. So now they're getting improvement in clinical symptoms, but are able to take less drugs. And maybe some other benefits, let's say better sleep or less anxiety. So these are the kinds of things we're looking for. But overall, I will even go so far as to say this could be, for many people, a very beautiful experience where they're getting some improvements and seeing some hope and seeing some results. And they've tried so hard, and many have tried so many things to get out of pain, and now they have some options. So something, again, I encourage, take a look at this article, again, published December 28, 2018 at healthcmi.com. I'm Adam White, licensed acupuncturist. I want to thank you all for listening. And until next time, I'll see you again. www.healthcmi.com.